Okay, and now I can't see any of you, but hopefully you can see the screen, can you?
Yes.
Yes.
Okay. So I'm just going to quickly first thank you all for coming together. And if we could go around the room before I review the objectives, because not all of you do know each other. And just do a quick introduction with your name, the role that you play at your organization and your organization. And why don't we start with Greg, since I can't see the screen and I know you are here. And then after you do it, if you could pass it on to the next person.
Sure. So my name is Greg Morris. For many years, I served as executive director of the Stanley Isaacs Neighborhood Center. When Isaac Center in Goddard Riverside got into a strategic alignment, my role changed. I am now Chief Program Officer at Goddard Riverside, which includes Goddard's programs and Isaac Center's programs. So very happy in this new role and this new opportunity. I'm going to pass it on to my colleague, Damian Samuels, who's here, who runs the show.
Hello, everyone. Yes, and so as Greg aligned, I'm now the Associate Deputy Executive Director for Youth Services at Goddard Riverside. Really pleased to reconnect with many of you and to meet some of you for the first time. And I'll pass it to my colleague, Shayla Simpson.
Good afternoon, everyone. My name is Shayla Simpson. I'm Director of Education and Workforce at Stanley Isaacs Center, and I'm happy to be on this call today. Are we popcorning it? Should I just pass it to someone else?
Yeah, please.
Okay. I'll pass it to Dave.
I just want to make sure I'm the only Dave here. So Dave Scott, Manager Work Solutions, Jumps First NYC. I know I've spoken with many of you before in one capacity or another. So looking forward to today. And this will come up later, but of course, throughout the whole event, if you have any questions that don't have time for today, please send them, Carrie, me, and we will get you answers. And let's see, I see Andre's here.
Hey everyone, good afternoon. So good to see you all. My name is Andre White. I am the CEO and Executive Director at Phipps Neighborhoods in the South Bronx. Thrilled to be a part of this conversation. And I'm going to kick it over to my Deputy ED, Dwayne Brown.
Good morning, good afternoon, everybody. Thanks, Andre. Dwayne Brown, Deputy Executive Director of Workforce and Education for Phipps Neighborhoods. Excited to see everybody, excited to be a part of this group. I'll pass it on to my colleague, Larry from St. Nick's.
Hey, Dwayne. Welcome, everyone. So I'm Larry Rothschild, I'm Director of Workforce Development at St. Nick's Alliance.
Going to pass it on to somebody, Larry?
Yes. How about Nisha?
Hi, good afternoon, everyone. My name is Nisha Zemke, and I'm an Associate Dean in Academic Affairs at Gutman Community College. And nice to see some familiar faces in the room. Hello, and delighted to be here. And I'll pass it over to my provost, Eva Fernandez.
Hi, everyone. My name is Eva Fernandez. I'm a provost at Gutman, a collaborator of Nisha's. Excited to be here. And I believe that Jody has not introduced herself yet.
Thanks, Ava. I'm Jody Sturgeon. I'm the president and CEO of PHI. PHI works to improve the quality of direct care jobs, so for home care workers, nursing assistants, and believes that work improves the quality of care for marginalized communities that we're all trying to serve. Happy to be here.
Thank you.
Pleasure to meet those of you that I haven't.
Thanks, Jody. So I'll just take a quick minute to review our objectives for the day. Started already getting acquainted with each other, the work and relevant priorities, and discuss prior partnership experience, benefits, challenges, accomplishments, needs, and explore solutions to serve the employment needs of job seekers while being responsive to industry demands. Now, I'd like to, before we dig into some more about Jobs First, oops, I was typing while I was starting the meeting, so there's a typo there, but I'd like to go around the room and if each of you could share and something that has shifted or changed or bubbled up in your healthcare training priorities what you're focusing on now, and if that's changed at all because of the pandemic. And I will get us back to a gallery view. And it could be one person from each organization, if that makes sense. And why don't we go in reverse order, and Jody, start with you.
Sure. I mean, I think the two biggest things for us that we're seeing and the needs that we're seeing with employers is the need for hybrid, if not fully online training, just in terms of access, but also topic specific training beyond entry level. So beyond bringing job seekers into the field, what we're seeing is a strong need for disease specific, long COVID specific, other types of topics that their training needs are significant at this point.
Thanks, Jody. Anyone want to volunteer?
I can go. So for St. Nick's, I think like a real need for internships in healthcare. That was a little bit difficult during the pandemic. And I think that, as we're working mostly with young adults, and that's a critical piece of getting the clinical internships.
I'll go. So echoing a little bit of what Larry said, we work with young adults as well. And I think as we sort of come out of this pandemic, we are looking for job placement in the healthcare field as well as internships. One thing that I think, of course, no surprise here, that has changed is the fact that most placements, whether job placements or internships, are requiring that our participants are fully vaccinated with flu shot, COVID-19. So that's been just a little bit tough to sort of recruit underneath those new parameters, and because most of them want the students to be fully vaccinated prior to onboarding. So like they have to have both shots, and I think some of them are actually implementing the booster as well. So it's something that we've had to include in all of our literature and our curriculum and stuff as we prepare to recruit students, to just let them know that this is now a requirement in the healthcare field. So you must have this to participate in our program, because the idea is to place you immediately after training.
Yeah, Eva?
To follow up on that, I'll say that all of our students are now required to be boosted and fully vaccinated. So this means that then working with any City University of New York student gives you that added attraction, I guess. We've had some really interesting, I guess, growth experience learning how to deliver internships online. But now as we come back, I mean, some of the things that you all mentioned are things that I've been hearing around Gutman too. One thing that I did want to mention, and this is a little bit of a self-promotional advertisement, we're starting a major in health information technology. Actually, just yesterday, we posted 2 faculty positions we'll be hiring. So I thought that you would be a really good group to maybe take a look at those. We're launching this major. In part, the plans were in place before the pandemic, but we see accelerated demand for this field during the pandemic also. So I'll post the link in the chat for sure. And please help us recruit great people.
Thanks, Eva.
I think for us, some of the challenges, I would just highlight that is just, we found that motivation of people to work, right? I think that is something that we kind of tried to push past, and we've been seeing a little bit of rebound. Now, we're launching a career network, healthcare next week, and so we've gotten more interest in the last couple of weeks. I would tell you we struggled a few months back in our last cohort, making sure that we had enough students to make it through the process, because that's another thing, right? They have to make it through the actual programming, and fighting that. A lot of our participants, some of them want that instant gratification. So keeping them engaged, we're finding our case management and wraparound support services are key to our engagement strategy and keeping them going. And so that's where we kind of been, we're getting a little bit better. We're starting to see the corner turn, we hope.
Thank you. I think every entity has spoken. And thank you all. Yeah, it's not that different from what we're hearing across sectors. There are obviously some things that are unique to healthcare. And maybe some of the requirements are more widespread around, vaccination and things like that. But it's similar, obviously, for city workers and lots of other sectors. So it's not that, different from what we're hearing across the labor market in New York City. Thank you for sharing, and we'll dig a little bit deeper into your experience and your needs. I want to just pass over to Marjorie right now, just to give some overview. I know most of us know each other, but there's a couple of new faces, so we'll give an overview of Jobs First and our sector networks and sector network strategy. So Marjorie, to you.
Great, thank you, Carrie. Can you hear me well?
Yes.
I've been having problems all morning. So for those of you who do not know us, we thought it was really instructive to just do a quick overview here of who we are. We were funded about 16 years ago through a collaborative process across the 5 boroughs of New York City, when we had 200,000+ young adults who were out of work and out of school. I hear a story about how the partners across the 4 of the 5 boroughs bounce names around and end up with Jobs First NYC. I could tell you the other 5 names that they shared with us. Some of them were quite funny. We work with about 160 partners across New York City. We're a neutral partner. We bring diverse partnerships together as we try to collaborate and scale outcomes or good outcomes, or collaborate to test new ideas. Our process here is the one that we follow for all the work that we do. All of us agree on what is the problem that we're trying to solve together, agree on what the solution should be, and then we test those solutions, and then the ones that work, we effort to scale them. Scale means replication, it means investment, it means the systems that we're working with and we're trying to change, those systems begin to respond to the changes that work better. And that could show up simply in the city of New York deciding to adapt something that we tested that produced better results. This is a process roadmap that you see in front of you. This process is consistent and standard across all of our work. We start with data. Asset infrastructure is really looking at what's in place, what's working, where are the gaps, what does the market tell us about what we're doing. And then goal setting as a partner, once we identify what the problems are, once we have all the information that we can have, then we begin to make some decisions around what we need to be doing. And then this is a project through every initiative has a set of what we call measurable infrastructure process that as we get through with them, we know that if we completed these things, then the partnership is in good shape. And we have a list of that listed here. You can see that someplace else. We really, in terms of our value, is we'd like to say that we have no good ideas at Jobs First. Anytime we come up with a good idea, it usually comes from the field. It usually comes from what communities are telling us. And our job is to, we said we're all experts, right? One of the challenges of collaboration is some of my colleagues in one of my favorite communities often tell me, we can do everything that you do. Just give me the stuff. And I said, well, that would be perfect if that was the case, if we had evidence of that, right? I said, partnership is about each of us bringing our expertise to the table and respecting each other's expertise and seeing how we can help each other do the work. You wouldn't ask me to come to your community if you didn't think I had something to add to it, right? So we have those fights all the time. I just love those conversations. Our solutions are focused on these 3 areas that you see here, which is community, which are our place-based work, where we're really investing in the infrastructure for community and how we can work together to really address stubborn issues that really diminishes sometimes individual success. People make it a good job, and then the issues that are historical and challenging the community affect their ability to kind of have that breakout moment that they have now. They've made some progress. Education is really around for us. You know, we know across 18 communities in New York City, high numbers of young people are out of work or out of school. Across those communities, those schools in those communities are also where you have high numbers of young people who are leaving school without a plan, without a strategy. We're not going to college, and we want to make sure that we stem the inflow of those young people into the out of school, out of work population. Our plan, master plan here is that every young person who graduates from high school leaves with a plan. They go to college, they go to training, they're going to work. No one should walk out of high school without a plan. Work is really this sector work, the one that you are involved in, and what we're having a conversation about today is what are the practices and policies that we can advance here that helps us to scale our work. And one of our great challenges that we have as a sector is really our inability to get employers at scale in sector to see us as a place to go and seek their talent. So they go to college, they go to employment agencies, they go to LinkedIn, but we don't naturally show up in that metrics as here are these folks that do the shorter term training that are very responsive to market. They're no more responsive sector to the market than our sector. We can get people trained and out to the market in the shortest period of time. It's the advantage that we have, right? So how do we do that to make sure that we are now showing up in those metrics of places? So that's what the work is, Solutions Works about. It's about advancing and developing new practice. And the policy work is really about a systems change. It's really about changing the infrastructure around how investment happen, about how practice gets adapted, and how both government and philanthropy invest in good practice. So that's us. That's the work that we do. Many of you know this work. And so I want to thank you for being a part of this next phase of the Young Adult Sectoral Employment Initiative that we're launching now. And I look forward to working with you during this time.
Thanks, Marjorie. I'm going to try my best to control 2 screens at once, so forgive me for any hiccups. So Marjorie really covered what our work solutions portfolio does, and that practices and the results are rooted in building and maintaining and sustaining innovative and effective partnerships. So our JobSource was founded to improve economic outcomes for young adults and to ensure that they have more and better jobs ultimately, and that the systems are holding any changes that are made to improve conditions in place. We focus on employment and career pathways to do that, retention and advancement in jobs, employer networks and employer needs, and strengthening institutional and employer practice. YASIP, which is one of our work solutions that some of you here were a part of, and it was the first demonstration project in the nation to test the effectiveness of adapting sector-based employment strategies for 18 to 24-year-olds. And it is an evidence-based model that was conceptualized in response to findings from the 2011 Sectoral Employment Impact Study. And it brings together, brought together an innovative learning community of employers, CBOs, and training providers to design sector training approaches that better serve employers and young people who are being left out of the labor market, with an explicit demand focus that was driven by labor market data and employer needs and specific employer partner needs that were part of the community. For Jobs First role, we raised and re-granted resources. We built this community of practice that you kind of see visualized on the screen here. We did testing, capacity building, and continuous improvement. And together with the YASIP partners, we developed a new outcomes framework that really elevated the importance of partnership and the importance of systems change. And from this work, and with many of the leading workforce development agencies in New York City, and some are now national, 10 sector training programs launched in healthcare, green jobs, tech, transportation, logistics, culinary, and technical theater. And one group actually involved into an employer-led seasonal talent exchange that was Wildlife Conservation Society. So this has kind of led us into an expansion of that work and why we're here together today. Sector networks, it builds on the knowledge that we gain from recognizing this effective practice and the process of launching the 2 YASP cohorts and the related projects that were galvanized by YASP models, including benchmarking for YASP and sector boosts. And the networks are really aiming to increase workforce development capacity, scale best practice and best-in-class training programs, and to be responsive to the labor market while increasing access to good jobs and advancing systems improvement. Over the past 15 months, Jobs First with partners Green City Force, the HOPE program, and non-traditional employment for women have been leading the development of one of the sector networks, the Green Economy Network for New York City. And this is a multi-stakeholder approach to building an inclusive green economy and advancing access to economic opportunity. Just letting Casey from OneTen in the room. The Green Economy Network is focused on 3 key goals right now: to develop new trainings and connect existing ones, to increase and deepen employer relationships and systems and policies that are aligned to the new needs of New York's growing green economy, both for workers and for employers. And similarly, with a group of high quality tech training providers, we've developed a technology sector network, which is also focused on similar goals. They want to be a collective bargaining mechanism with employers, a go-to source for talent with less than a 4-year degree in the tech sector. They're working to establish a data set, tools, a way of collecting and sharing information that can exhibit the impact of skills-based hiring. And they are scaling training, creating upskilling pipelines, and finding other ways really to partner with each other and potentially impact policies in New York City around tech training and CUNY articulations. And wrong direction. I'm going to pause there. Let me take this down because Casey has joined us. And I think, hi, Casey, I'll let you introduce yourself. Casey is the case lead. Sorry, I'm butchering your title. I don't have it in front of me. Case team leader, I think it is, with the Bridgespan Group. And she's the leading, the regional lead. You tell me, you tell them, for OneTen in the Northeast area.
Yeah, that was it. I mean, different words, same essence. As Carrie said, I work with the Bridgespan Group, who has been supporting OneTen for the past 1.5 years, like since inception, with the goal that OneTen will hire its own staff to lead this work. But I'm kind of the interim solution here to talk to you about what OneTen is and how we're working with Jobs First. Carrie, have you talked about what our relationship with Jobs First looks like, or should I cover that as well?
I have not. No.
Cool. Well, this will be like a fun reversal where I explain what you do and probably get the words wrong as well. But the main way that we are working in different markets is by identifying a really strong key player that is already within the city, working within the community, that has connections to both talent and then talent skilling programs. And so we call that position the community development lead. And so Jobs First is our community development lead in New York. And we have a number of other partners across cities in the US, but New York is by far the biggest and most exciting. Don't tell anyone I said that. So we're excited to be working with Jobs First, and they give us really awesome opportunities to meet with lovely organizations like all of yours. So I'm here to talk about OneTen. I will try and give a brief and comprehensive overview, but I'm happy to answer any questions as we go through. And also, you should all maybe have my contact information. If not, Carrie can share it afterwards if you want to reach out with questions directly. So I am currently sharing a slide. Can you all see it? Great. Okay.
Yes.
Awesome. So I believe some of you have already heard the OneTen story, so I'll try and make it a little exciting or vivid for those of you that are repeats. But OneTen is a corporate coalition of companies that have committed to hiring and upskilling 1 million Black individuals without bachelor's degrees over the next 10 years. So it's really focused on creating opportunities for Black individuals without bachelor's degrees in the US. When a company joins OneTen, they're committing to several different things. The first and foremost is that hiring and retention of Black talent within their organizations. The other thing they're committing to is joining a community of practice. Both their CEOs and their heads of HR have separate communities of practice each quarter to discuss anything related to OneTen, so that forum normally has a spotlight on Black talent, either within the organizations or external to the organizations, and how their career journey has progressed, different obstacles that they were faced with in their journey, in part because of corporate practices that shouldn't be what they are. And then also an opportunity for CEOs and CHROs to present to each other of things that they've instituted within their organizations, what went well, what they would do differently. And then within that community of practice, there are also a number of working groups where we really dig deep on specific topics, whether that's shifting to skills first hiring, improving retention, identifying opportunities for upskilling and advancement, identifying ways to support veterans and veteran families. And there's, I think, one on rural jobs as well. So basically, wherever there's an employer interest as it relates to the OneTen goal and they want additional support, we've been able to launch a working group for anyone within the company that really leans into the OneTen work itself. So normally the DEI lead, the actual hiring managers, HR personnel as well. And then the last expectation from a OneTen employer is to contribute financially to OneTen, which then OneTen is using to fund our work in communities. So questions on like what a OneTen employer is committing to or what they've all signed up for in being a part of OneTen. Cool. Okay, should check the chat. Okay, awesome. So then, as I mentioned, OneTen is specifically focused on Black individuals without bachelor's degrees. So that's the one goal that we are tracking for 1 million. We are obviously in doing this with the hope that it improves opportunities for all people within the workforce of the United States. So specifically tracking the Black individuals without bachelor's degrees, but with the acknowledgement that we're partnering with organizations that skill all types of people, and we're partnering with companies that hire all kinds of people. So this by no means is solely focused on benefiting Black people in the US. It's focused on really rising all ships within the workforce development landscape in the country. I will keep going until someone shouts at me to stop. So feel free to jump in with questions either verbally or in the chat. So we've gotten a lot of questions about like, what is a OneTen job? So we have 4 different categories we use. The first and most important is that that job provides a family sustaining wage. So we use the MIT Living Wage Calculator to determine that. In the New York area, it's around $63,000, and that includes benefits. The second is that the jobs are not going to be immediately automated. So we're really looking at jobs that are here to stay, that can provide lasting careers to individuals. And then the second bucket of qualifications we're looking for are they don't require a 4-year degree and they don't require an extensive amount of experience. So not all of OneTen jobs are entry level. Some of them are mid-level management that require a couple of years of education, but they are all aiming to be accessible. And so we work with employers to help identify like what within your job, like open job openings, could you potentially remove the 4-year degree requirement? Okay, great, you've removed the 4-year degree requirement. Are you actually hiring people without a 4-year degree? If not, like what are the barriers to getting you to do that? How can we help? How can we connect you to non-4-year degree talent? So that's what we look at when we're talking about OneTen jobs.
Casey, there's a question about.
Yeah, I see. I was going to ask the question, but Dave already jumped in saying it's coming up.
It's coming up. I'll have a slide with all of our partners. It's also on our website where you can see all of the companies that have joined the coalition and have signed all the things that say we can list their logo. There are, I think, like 5 to 10 that have joined, and like their logo is not on our website. So we are ever growing. Right now, that's mostly Fortune 500 companies, in part because we were founded by Ken Frazier of Merck and Janira Mehdi of IBM, and then Kim Chenault of American Express. And all of their friends are Fortune 500 CEOs. So like by the network effect, that's who we've recruited, but we're looking to expand to small and mid-sized companies as well. Awesome. Dave just took my punchline, our year 1 progress that he shared the link to in the chat. Thanks, Dave, of what we were able to accomplish in the first year. Some key highlights are our employers are able to hire 17,000 individuals into OneTen jobs. So 17,000 Black individuals without bachelor's degrees into those family sustaining wage jobs. And then 4,000 promotions. So really strong progress for year one that we're excited to build off of. And then the thing that I'm really excited about is this 1,700 number. So this is the amount of hours that senior leadership within our companies have invested into OneTen, either through the communities of practice, decredentialing conversations, and the commitment that they've had to like talking to new talent developers to form those relationships. So we're really excited by the amount of time and effort that's been invested for companies to really commit to this change. And Dave posted the link in the chat so you can fully read through all of the exciting stuff that happened in year one and where we're looking to go in the future. So as it relates to all of you, you all host skilling programs. So as we think about how OneTen is working with talent or helping to identify talent, get people connected to these job opportunities, we call them talent developers. People say skilling programs, but there are a number of ways that we're partnering with talent developers. And the first main one is endorsement. So we look at your program, say like, yes, y'all are doing great work. And then you would have access to a number of opportunities with OneTen. So the first and foremost is you would get connected to the employers and the jobs that are within the OneTen network. The second is you would be listed as one of our endorsed talent developers, both on our national website and our national promotion, but then also when we start to do on the ground marketing in New York, your organization would be promoted through that. We also have a number of wraparound supports nationally, and we are planning to launch them locally that your students would have access to both when they're in your program and then after. So we've been able to offer backup childcare to all of our talent developers in Dallas, and then we've offered point-to-point transit in Philly. And so we're trying to figure out like what works, what people are interested in, but that's one thing that we've been offering as well. The technology system where a lot of this is hosted, both the jobs and where you could get connected to new talent to sign up for your programs. And I'll talk about that a little bit more in a second. There are also opportunities for financial support with OneTen. So as I mentioned, employers are contributing to OneTen financially, which we have then been able to grant out to our endorsed network. So there's been a general support grant, just acknowledging the time and effort it takes to go through endorsement. And then there will be other future opportunities for grant support. And then another thing we're really excited about that's fairly new is the community of practice for talent developers. So we've been able to bring together everyone within our network nationally, which is about 95 organizations right now, to talk about systems change and different components related to skilling and hosting skilling programs. And so we've let our talent developers kind of set the agenda of what they're most interested to talk about in that forum, but we have our second one coming up in a couple of months. So that's what we've been offering our talent developer partners. This list was curated after a number of conversations with nonprofit organizations, for-profit organizations, and some community colleges. So we think it's pretty holistic, but we're also always willing and excited to hear of other things that talent partners would be interested in having from OneTen as a part of our network. Okay, I'll keep going. All right, so I mentioned the tech platform in the offerings. So this is a slide that walks through it, but Carrie, I think, can share a video afterwards, kind of giving a view of what it actually looks like in action. But there are 3 key users of this tech platform. It's really as a place to connect all of our 3 key users, whether that's companies with jobs, Black talent that are actually looking for jobs, or talent developers that offer programs that can help bridge Black talent to jobs. Also acknowledging that there are plenty of people that can just go directly into jobs. So this platform currently exists. It's in like version 2, so we're still like learning and taking a lot of feedback from end users. But it provides both opportunities for people, Black talent, to get connected to a job, but also to get connected to your programs if you are hosted on here. And Dave, yes, mentioned that it is powered by our AI partner, and it's called Eightfold. It has a lot of really cool AI components that I can not fully explain how the AI works, but basically it helps people create a resume, get actually matched to a job based off the skills that are within their resume and the skills that the job is looking for. And we can also help create a tailored resume for a specific job. They can also help map someone's career trajectory based off of what they're interested in, what skills they have now, and how they can grow in the future. And this is the list of all of our employers as of, I think, November or December. So it's definitely gotten longer since then, but you'll note that it's a lot of big companies, as I mentioned, but it's a pretty good mix of industries. And we do have a number of healthcare organizations, both in New York and then also outside of New York. And then the full, I think probably a little bit more updated list is also on our website. I will pause for any questions. I know that was a lot of information. Also happy if you want to have like a further more in-depth chat one-on-one or with Jobs First, happy to do that as well.
Thanks. Questions, comments?
And understandably, if you have, oh, go ahead.
I was just saying, I feel like I completely overwhelmed everyone. Feel free to reach out afterwards if you have questions.
I just would like, I think this is a great initiative and kudos for all the work that's been done. I want to figure out how we can do a better job of promoting this, because I wasn't aware of this initiative, and I think this is excellent. And I think people in my network would be interested in understanding and learning more about this. So for me, it's, how can I support in promoting this kind of initiative, because it just seems like it's well run, it's a well thought out, a lot of work and commitment has been put to it. So yeah, just let us know at FIPS how we can help promote.
Yeah, great question. That's part of what Jobs First is going to be working on as the community development lead for New York. A lot of it's about just first letting people know that this exists, then letting people know what the value proposition is, figuring out how to get the message out to job seekers, to SMEs, and really get more people involved in this, because this is one of those things where the more people get involved, the better the system becomes, the more value is actually created overall. So we will work on that. And of course, we welcome any suggestions and input that you have. OneTen is doing this in a lot of markets, but as Casey pointed out, the New York market is always a bit different, not least because of its sheer scale and number of entities involved. So getting the word out is perhaps more time consuming, but also more valuable in the long run. And we also have, Casey didn't mention talk about as much, but there's also an employer lead for New York. Jobs First is working with the employer lead. And so none of the items are mutually exclusive, right? We're also talking with employers, they're talking with workforce developers, but really trying to split the load because it's such a mammoth undertaking.
I had a question. It occurs to me that we might be interested in being an employer as well as a developer. I just wonder if you see that happening at all, if some of the folks that you're working with as offering the training also are wanting to be those that are hiring and sort of marked as employers as well.
Yes, we have a couple of organizations that are both a talent developer and an employer. It takes a number of different forms. So a good example is IBM is an employer, but they also offer PTech, which is a high school equivalent for a technology training. And then Bright Horizons is a really good example of like someone that's kind of straddling all of the different archetypes. So they offer childcare. Our childcare vouchers are through Bright Horizons and their childcare network. They also are an employer, and then they also offer trainings through one of their subsidiary companies. So it's definitely something we've seen before. And normally our team that works with employers is like able to figure out what that means specifically for you. And if you would start as a talent developer and then scale to an employer, if you would start as an employer, scale to a talent developer, or start with both. So happy to have that conversation, probably more one-on-one.
And feel free, since tons of information going out to you to check out the FAQ, check out the year one report, and then send us all your questions. Send to Casey's and Garrison to me. We'll get them to whoever has the answers. And of course, we can talk more next time if anyone has things that are better discussed in group conversation. Since we're a little bit short on time, if no one has any questions for right now, go ahead to the next section. If we have some time at the end and you have some questions, bring it up then and we'll come back to that. Right now, it's going to present a little bit of healthcare data that hopefully is useful. Some of this are things that you've all seen before. Some of this might be new to you. So what we're looking here in this first slide is some real-time information about job postings for healthcare sector, more specifically healthcare support broadly in New York City specifically. And this is coming from job postings across various services, deduplicated. So these are correct, only active in the past 3 months. Don't worry, the numbers will come back in a moment. And this also includes some wage data, although only about 12% of job postings tend to include the wages. So this is not going to be fully accurate. And of course, between Omicron and everything else, even though this information gets updated daily, and I just grabbed this week, who knows what next month will look like, but probably nothing surprising, right? That nursing assistants, medical assistants, home health aides, and personal care aides are the top in-demand jobs. In the next slide, we're going to see, instead of occupation, job titles, which again, very similar. Some of it just depends upon how these things get categorized. I was looking some months ago at the hospitality jobs in New York City, and Baker 100% tuition reimbursed was one of the top jobs in New York City because Starbucks was hiring so many people. So it can also be in effect about the way that these things get classified, although in healthcare, usually things are categorized pretty well. That's less true sometimes in hospitality or certain other industries. This probably none of the numbers here are surprising in terms of employers either. Unsurprisingly, the biggest healthcare entities are the biggest employers. And really the point about having the job ads here is also important to see as it compares to jobs closed, because that gives a sense of turnover. So when there's high turnover, places are closing lots of job ads and opening lots of job ads. And if there are some times where you're going to see issues where things get counted in weird ways, like Columbia will show up sometimes as Columbia and then Columbia's faculty branch, or sometimes Amazon shows up as one thing and then Amazon Web Services as another thing. But as far as healthcare goes, this is less of an issue. And again, probably things that you've already seen, but in case this raises any questions, happy to discuss with us later. And then going to the next slide, you can see a little bit different. This is not real-time information. This is information mostly from Q3 2021, with the exception of wages. The federal government only publishes detailed wage information each spring, that shows the information for the previous spring. So 1 year out, which normally is fine. These obviously are not normal times, but still kind of useful to get a sense about where the growth forecasts are, what the wages kind of look like. If anyone's curious to dive in more and just want some easily publicly available data, the New York State Department of Labor website always has some great information that is not greatly presented or easy to find at all, but it is always there and free. Yes, the staffing pattern, again, I think this is useful depending upon the kind of trainings you're doing or what people are interested, thinking about the difference between the people who are in healthcare and doing medical work versus the ones who are not in doing medical work per se, but are obviously crucial to the execution of the industry successfully. So trying to get a sense of what those other occupations look like in terms of wages. Again, this is going to be some early 2021 data. Once the some of this 2021 data, some of this is actually 2020 data. Again, once the latest data comes out on wages, we can look at that, get that information to you. But of course, by the time that those new numbers come out, they may well already be partially obsolete. That's part of why that real-time information from the job postings is so useful. Pretty consistently, those numbers are higher. This really just giving you an overview of healthcare in New York City. Perhaps unsurprisingly, healthcare jobs form a bigger part of total employment in the city than they do nationwide, given how many big medical institutions we have here. Also, unsurprisingly, the healthcare industry is growing in New York City, as it is generally growing nationwide. So generally things going in a good direction in terms of wages, employment, and as we see on, I think the next slide, and also in terms of the, yes. So this just giving a quick breakdown. Again, these are not the absolute latest figures because those figures don't exist yet, but just looking at a breakdown of the demographics of the industry, I think is super useful in trying to understand who's going into these, who's already in these positions. It would be great to see a side-by-side of who's already in these positions and who's applying for and interested in these positions right now, but not already in there. But really trying to understand what the sector looks like in New York City and how we can change it if we want to change it. And next slide. Yes, that's what I was thinking of. So we hear a lot about mergers and acquisitions in the healthcare industry, like any other industry, but actually in New York City, at least through 2020, consolidation has not been the name of the game. The number of healthcare entities or entities in which healthcare workers work has continued to grow at a considerable pace. Again, some of these establishments might be schools. They might not be the traditional health care establishments that we think about, but it just means that at the same time that we have more hiring happening and more demand for labor in the city, we also have more individual entities that are hiring, which in some ways makes it more difficult for us to reach out to everyone, but also means more places where people can work and more competition, which hopefully drives up wages for our trainees. Yeah, so I know that was a lot of information, very quick. Don't worry about any specific takeaways, but if anyone has questions, obviously if there's something you think about later and want to know more, happy to discuss that with anyone. Great. Well, again, if you have any questions later, feel free to send them to me or to Carrie, and we'll try to get you some answers. For now, we're going to switch over and talk about you and what you're doing. Carrie, if you want to take over from there.
Yeah, sure. Thanks, Dave. So yeah, no more slides. We just want to be in a room in the space with you and hear from you about, anything that you've heard today so far, anything that you have questions about or reflections on that. And also just, bigger picture, like what's going on for you in healthcare. We touched on this in the beginning. We're really curious to know if any of you have been part of networked partnerships of like groups of agencies working together in healthcare training or something similar to that, if you have like that type of partnership and network experience, and what about that has potentially worked and not worked, if you've been a part of that, and what you think a network structure like what we described for the Green Economy Network and what we described the Tech Sector Network is doing, what you think as a group we might be able to focus on and accomplish together, what needs and challenges. I'll pause there. And again, popcorn, I'd like to make it just informal conversation, wishing we were around a table together, but would love to hear from you.
I'll start and I'll say, I feel like I'm still in the position where I'm learning so much about kind of like how this group functions and kind of how we fit in and which ways it makes sense to really engage. But some of the question that comes up for me is, thinking about work, I would say we're still in the early side of doing, but connecting with settlement houses and that kind of model across the city. We're looking at the umbrella organization, as well as specific organizations, including some folks in this room. How do we start to really engage, as a place that offers different kinds of training and education with the community more broadly, listen to that community well. And then I would say also, and I kind of was thinking about this too, in the context of this conversation and the different pieces we've had of like, how do we feed back in, right? So how do we help students learn about the opportunities that sit right in those neighborhood houses or support healthcare needs in that community? So those are some of the things I'm thinking. I feel like we're learning a lot and we want to become better and better at serving the communities that we're connecting with. And maybe one of the questions is then how do we make sure that we're, if we're sort of thinking of a pipeline coming from the neighborhood houses, how do we also build back in, right? Maybe offer that talent and help explain where the talent can go, right, back into those communities, including the healthcare component, right? And so I was thinking about conversations we're having about building a community health worker program, case management. The provost talked about health information technology program. We have a human services program, and trying to make that a richer sort of ecosystem, maybe. So that's one of the things I thought of. I don't know, exactly how to engage this group around those ideas, but that's what makes me excited, I guess, of being in this room and hearing about some of the initiatives that you're pulling together.
Thank you, Nisha. Yeah, I think, you're beginning to talk about like what's the connectivity and potential pathways for people to have options, right, of different types of trainings or advancement opportunities, which may be more relevant. There may be overlap of some things that you do and what some folks in this room does. So how does that, what Nisha said, resonate with others in the room?
Well, I'll jump in. Definitely resonates with me in trying to, again, I think we all are glad to be in the room and figure out what's the right rhythm of this group, right? And I think that there's two things that kind of jump out to me of ideas on how we could collaborate. One, promotion of the healthcare in general, healthcare services and the need for healthcare. Like, is there a campaign that we can do as a collective? Our reach is the Bronx. Like, that's where we particularly reach out to. But I think as a whole, this whole city needs to know about the opportunities that exist in healthcare and how important it is. So as a network, can we come together and create some kind of campaign that we all can do and be a part of to promote these opportunities in healthcare? And then a second opportunity that I see here, or I think that may be, is once we get them into the healthcare field, what we just partnered with the New York Urban League to really help us with the upskilling of our participants. Is there an opportunity to share resources around that, right? We don't want to just get them a job. We want to make sure that they have a career, right? And that there's opportunities for advancement. So are we, sharing resources around curriculum or how we get them to the next step in their careers? I think that might be something. It may be something that we refer people to. I may have a great participant that starts off with me, and then I can take them but to so far, and then I call Larry at St. Nick's and say, hey Larry, I got this participant here. Now they're ready for this new job that you got with the big hospital down in Brooklyn, and making those kind of connections. So I think coming up with some kind of campaign together, promotion about all the healthcare, and then figuring out how we help our participants, upscale and where the opportunities, exist.
I think oh, sorry.
No, go ahead, Jody.
I agree with everything that's been said. I think for me, what I would love for this network to be able to do is balance and lift up the importance of bringing people into the field and upskilling and advancement. I mean, obviously PHI does a lot of work in that space. I think the thing for me is this notion of raising the floor and building ladders, I think is critical, and particularly right now, given the basic data, the basic demographics say that the entry level positions are the fastest growing jobs in the city, and so how do we make those jobs better, while also giving opportunity to folks to upskill and to move into different positions. And so I just think that there's a way, I would love for there to be a way for us as a network to hold both equally, improve the entry level job, so that it is a career, right? Like, because that's the thing, and it's real. It's not a career because it's not a quality job. The salary isn't what people need. And so, but how do we as a network hold both of those things together and say, look, we want to give people who want the opportunity ways to move, but we also want to, really take on the fact that this very critical set of jobs on the front line are not quality jobs. For me, if we as a group could achieve that, I would be thrilled.
Sure. So I'll sort of echo what Jody said. I think you said everything I was going to say. I really just was thinking about healthcare and sort of the wage, and just wanting to speak to our students getting opportunities after completing training that are not just entry level positions and also have a higher wage so that they can be on their way to a career path. Something that we do in Stanley Isaacs, we have a healthcare cohort and we do 2 trainings. So one, we do a HHA training, and then we also accompany with another CBO and do a CNA program. One thing that we've been sort of ramping up in our training program is making sure that we get our students certified in certain areas so that when they go to these jobs, they're not just, a medical assistant, but they might be a medical assistant who specializes in phlebotomy or who has some technician experience. We've been getting them CPR training and some psychological trainings, just because we've been connecting with other organizations who offer healthcare opportunities and just trying to figure out what do we need to prepare the students for? Like, how can we get them a little bit higher than entry level positions when they go into these employment opportunities. I think one thing beneficial for this group is just sharing best practices and resources. I think we've been having a challenge in getting our students in sort of these hospitals. Like, how do you get into the hospital? Who's the connection, or what person should we connect on or speak with? We have a couple of internship opportunities right now and staff that work and are trying to work with Metropolitan Hospital. And it's just like, well, what's the language that you speak, when you're sort of seeking these opportunities, what language do you use? How do you prepare these students to get into these roles? Because we know that they have to be a part of the employment system in order to see what jobs are available. So I think that's what I'm looking more to connect with everyone on, like some of the best practices and resources you guys may have and sharing amongst each other.
I'll add to that. I think I agree with everything that's been said. St. Nick's, we also run an HHA training, and we run PCT and CNA training for young adults. And I think what really resonates here is that we really do need to find ways for higher wages for entry-level jobs in healthcare, and opportunities for advancement. That's really key. And I do think that there's a big opportunity here to share best practices and resources, potentially on internship opportunities. Maybe there's also a way to develop a mentor network as well in healthcare that, especially for young adults, that could be helpful as well.
Thank you, Shayla, Jody, Larry. You're naming, all the things that networks can do better and more powerfully, I think, together than one individual agency. I know some of you work on policy issues as part of the work that you do, and some of you probably have been investigating and collecting best practices. And I know there's some overlap of what trainings you do, but obviously there's not really competition, right? Because the labor shortage in healthcare is projected just to be far beyond what any of our agencies, even combined, could train for. So yeah, I mean, I love, what I'm hearing. I don't know, I'm not familiar with any sort of like healthcare network that is bringing together training providers such as yourselves. And so, my conversation, we had a similar conversation early on with tech partners, and there were a few. And so there was this conversation of like, where did they succeed? Where did they fail? But I don't think there's really something like that in healthcare. And then there's a lot that that I don't know that you all probably do about the intricacies of the union. And, there's that whole piece of it. And where would we want to involve them, if at all, in these conversations? So a lot to learn from you. And, the early things I'm hearing around like a shared marketing campaign just for the sector overall, changing the impression of it, recruitment, cross-agency referral, ways of like sort of maybe sorting or organizing the pool of candidates based on what their interests are. Even if it's not your agency, maybe it's another agency that's training in the thing that's right for that person. Obviously upskilling, advanced training that some of you do and some of you don't do. So there are a lot of areas for collaboration. And then equally as important, Jody, what you raised is this balancing of job quality and policy, and how together can we really push on those levers, right? And the Green Economy Network is doing this now in real time. So I have some experience with a network of 40 some odd organizations that have been coming together, working in like a task force model to quickly get together a set of proposals to get in front of the incoming administration as they came in January to say, like, there's investments happening in infrastructure and the green economy, and it's going to be coming through the city. And we want to be part of that conversation of how it's determined, what the policies are, how the money is spent, how it ties to job creation. So, there's a lot that a coalition of training providers can do together, leveraging all of your own resources and knowledge to do that. Just looking at time, and I'm wanting to make sure that we kind of prepare you for another meeting. Oh, Lakeitha, your hand is raised. Let me turn to you first. Lakeitha.
No problem. Hi, this is Lakeitha. I work for Strive. We've done, so currently we do help like support training. We're getting people into more of the like patient transporter, hospitality, maintenance. And then we also have one that's designed for the health office opportunities, which you could see in the chart is still growing, where they get electronic health records certification. I was a part of a consortium in the past, but it was more informal. It was with NIACH and like a couple of other of us who were all building at the time. We were building a pathway for the health office type of jobs, and it was designed so that we could just learn from each other, since that nobody, as you mentioned, is going to put a dent in the labor market demand. And so that way, when we're branching into an area where there is opportunity, we weren't all of us creating different, but and there was a partner, so a part of the network. So we've also in the past did a advancement training we actually got some limited funds from Kellogg to take people who were working in entry-level office, health office positions and help them move up to a medical billing. And that was like taking people who are employed and training them in the evening. So my thought, I'm in favor of us going further. It was really helpful to be a part of a network that was sharing curriculum. I also was a part of something that UMES did to help get more people in Upper Manhattan into unions. And so that was partnership with 1199. And so that was a group of us working together to really bring about improvements into 1199. And so I've seen the power of companies being able to band together to get into the union, go a little bit further. So I'm in favor of all of those. I think also typically I don't know that people think of childcare as a part of the healthcare, but I see when you're talking about union, it's really necessary to have different childcare, because once people get hired at a union, they have to be low man on the totem pole, so to speak. And that really requires there to be childcare. So, I mean, my thoughts is that I would love to see somebody from LaGuardia, because they do, or community college, because they do a lot of the advancement stuff that we're talking about, where people can get higher wages and often require people who get the foundational work that we're doing. And then someone from who's doing childcare, just because they have to go hand in hand, or people can't take advantage of the off hours that are expected of people who first get hired with the union. Those are my thoughts.
Thank you, Lakeithia. Great notes. I thought I heard somebody chime in. Did anyone have a comment? Okay. Yeah, you actually reminded, I can't believe I forgot about NIH, but recently a lot of people have been asking what's going on with them. I know they've had leadership transition and I haven't heard much. So something for us to, look into if there's any kind of network things happening through them. But yeah, a lot of good points, and also just something, I don't know if Casey mentioned it when she was speaking, but OneTen also brings in a lot of wraparound support services, social support service partners, and can potentially be a resource for us to check with and see, who's providing those sort of really robust types of services that include childcare and things like that. So thank you for those notes. I see a hand raised.
Yes, so just quickly, and I'm sorry, I do have to hop off. I just wanted to know if there was going to be sort of like a contact list sent around of all of our different contact information. There's a few people that I definitely wanted to connect further with, in addition to staying in contact with this group as a whole. But, I know Larry sort of serves youth services and we do similar programming. So just looking to network further.
Awesome. So you are a great segue, Shayla, into what I was going to say, or Dave, but I'll get us started that, for next steps, right? So one quick update I wanted to give you. I think you all were a part of submitting information for the Good Jobs Challenge application, which went in February 10th. We don't know what it means, but Chuck Schumer's office reached out to us to ask for a copy of it. So we got excited, and then we were like, well, we don't know if there's a reason to get excited, but we'll keep you posted. And I think it's probably months away before we'll really know anything, but we'll see. So good news there, and thank you for your partnership in that. And then following this meeting, we will send out a simple Google Forms survey just to collect who on your team, in addition to you, who was here, right? We'll share who was here, of course, but then who on your team, in addition to you, should be on this contact list and should be invited to the next meeting. And Dave, sorry if I'm biting on your lines of things you plan to share. But for this meeting, we were hoping to have, I don't know if any of you are familiar with Jade Grieve. She was recently appointed to a new position at the NYC DOE called Chief of Student Pathways. And we were hoping she was going to join today because she's doing a major information gathering session to roll out an entirely new strategy at the DOE around student pathways. And she wanted to learn from all of you. So in the follow-up, we'll have the survey about, contact list, who else should be included, maybe a couple of questions about what we work on as a network, and then dates. to come together again, and hopefully within the next like 3 to 4 weeks, we could find a date at the very least to have that kind of question and answer session with Jade, because she wants you to inform the strategy, and I want you all to be able to contribute to that.
Yeah, can I just say, for those of you who may have already been, maybe you're already working in high schools, and she wants to learn about how that experience has been, how can that be improved. But the Chancellor Banks, has said that if he leaves no other legacy for his time with school, is that it'll be that career integration will be at school. Like kids can go from their math class to their English class, their career class. And it's not a thing that happens at 3 o'clock after school or happens on Saturday, right? And so he's made a real commitment to this. In his first official announcement, last week, I think it was, I think the first thing out of his mouth, or the first initiative out of his mouth was this. So there's a real commitment to it. And what we're trying to do is really having, done some of this work in school, trying to figure out how we help them to build a type of system that makes sense and not ask schools to do work that they're not expert at. Workforce organizations are the expert at workforce development. So we want the schools to work with the workforce organization. Of course, workforce organization has to learn schools, right? Because a lot of us don't understand schools. We have to, do some work around our curriculum. As Larry knows, they've done some really good work, and they brought their work to some of our stuff, and folks have learned from it. Dog is jumping up. And so this, having your early input, having a group that they can talk to, that Jade can begin to build kind of an advisory group around how do you, integrate healthcare sector career, conversation in schools and what that experience could look like. They're designing and building it now, and they're hoping to kick some of this off in September. So we're hoping that our network, what I'd like to see is our network become her default group that she consults with as she builds out, and we bring other people along to doing this. So it'll be health, it'll be tech, and green is not quite in the mix yet. But the other pathways that they're interested in, Jade's oversee computer for all. They don't really have any career integrated work much into that portion of their work. And then the other area of work, which I think Andre might be more a specialist around this, is they want to do a career integration pathway potentially into, these are more like social sector jobs, right? Maybe after school. These are public sector jobs, right? And that we've been noodling around with, all of us been talking about for years. So that's what she's looking at, those 3 areas: tech, healthcare, and this kind of public sector type of job. We're hoping that we can, through your experience and your relationship that you will hope to cultivate with her, that you guys can inform and advise on some of where they want to go with the DOE.
Thank you, Marjorie. Sorry, we're a few minutes over, and thank you for staying. And we will follow up in an email with the things that we promised we would, and look for times to set up that meeting with Jade.